There you go. No traction that way. And extra rotation. And then pull. There you go.
Oh.
Yeah. One more time. There you go. There you go. Okay. Can you move your palm up and down? Can you move your elbow, rotate it out, and then and then check the deltoid muscle. Can you fire? If you cannot, then what? Possible axillary nerve damage. And under is make sure to have a witness when you talk to the parents to protect yourself. That's what I mean. You really need to do that, which I almost got sued at one point. After 4 or 5 months, kids couldn't do anything, and they're trying to sue me. It shit happens. So you need to protect yourself. So, many more techniques in shoulder one, but the technique you guys did right now, I think it's really solo technique. There's no guarantee you're gonna have help. Sometimes you're solo, and you have to find a way on your own to do it. And then that's the technique I think is very useful to do. So you can do that when the kid is sitting down on the bench already, and use the same technique, and then it goes in. So, all right. Any questions?
You gonna show them one more maybe technique?
Yeah, there is a technique. 2019 Las Vegas. Doctor from Ohio, I forgot his name. Called Forest technique. It's now free. You look it up on YouTube. Go Forest fast, reliable, safe technique. And they say they have some kind of research paper to prove highest success rate without any kind of mitigation, which is good for athletic trainer setting. Which to me, it's kind of biased research because you're looking for that paper to prove your point. But anyway, so Forest technique is keep the elbow straight, not too much tension, and then up and down move, and get to 90 degrees, you add extra rotation, and then traction altogether. So, all right, who wants to do first? So here, okay, stand, okay, right there, okay, and no, just pull that, okay, and keep the tension elbow, not too much, but keep the elbow straight, not too tight, okay? And then go up and down a little more, up and down, now I see slow, up and down, and then get to about 90, right there, and then other rotation. Yeah, this table slips. Okay, and then come to about 90, and then not too much traction, but extra rotation. So it goes in before, there's nothing wrong with that. So not all the same, so.
So don't contract it like it.
No, you have a traction anyway. You have a little traction, and it's like I said, some might be going in before get to 90, there's nothing wrong with it. Up and down, and then get to 90, and extra rotation. One more time. Traction, rotation. Come on. There you go.
Doctors.
We check the pulse, check everything, palpate, check the overall process, it's intact, there's a huge gap, all right, now it's dislocated, so now you have to reduce. So there are a couple of techniques. One technique I used was to 150-pound football player, not big. So I used one hand, the other hand, and then I did that. But can I use it for 300 football player? No. So there's two techniques. One is face up, one is face down. So face down technique-wise, put the patient on the exam table, like this, and then you use one hand to hold up arm, and use the other hand to hold wrist, and just straight down. And if if you're not strong enough, then you can ask somebody to hold the upper arm, and then you just focus on this. Okay. Or face up technique, same concept. Put your body weight and then up. But some people are short, some people are high, so it might not be easy to do on the table. But if you're on the ground, that'll be easier. So, all right.
Traction initially?
Well, it's always exaggerate what happened, but it's not going to go farther than anyway. Then trying to make a space. There you go. There you go.